Right this second, as you're watching this video, your legs and feet are screaming emergency warnings about your heart, and you're ignoring every single one of them. Listen to me. Over 6 million Americans are living with congestive heart failure. Most of them had absolutely no clue that their swollen ankles or ice-cold feet were desperate SOS signals from a dying heart. And here's what should terrify you. Chest pain is not the first warning. Forget everything you've seen in the movies. Heart failure doesn't announce itself with dramatic Hollywood chest clutching. Instead, it whispers through symptoms that 94% of people dismiss as just getting older, being overweight, or standing too long. That ankle swelling, those numb feet, these could be your heart's final attempt to save your life. If you care about living, if you care about being here for your family, hit subscribe now and turn on notifications, because what I'm about to tell you, your doctor probably hasn't. Drop a 1 in the comments right now if you're paying attention. Drop a 0 if you're still in denial. Your life is on the line. I'm about to reveal 12 scientifically proven symptoms that manifest in your legs and feet when your heart is beginning to fail. These aren't random aches and pains. Medical research has proven each one is directly linked to your heart's declining ability to keep you alive. Missing them could be fatal. Catching them could save your life. Stay with me because symptom number 9 happens while you sleep and affects 78% of heart failure patients. Yet almost nobody realizes their heart is failing until it's too late. Symptom number 1, cold feet that won't warm up. This is not normal. Listen, when your heart starts to fail, it faces a life or death decision. Which organs get the blood and which organs get sacrificed? Your body goes into survival mode, frantically prioritizing blood flow to keep you alive. Brain, heart, lungs, kidneys get priority. Your feet? They're expendable. They drop to the bottom of the list. Research in Circulation, one of the most prestigious cardiology journals in existence, documented this with terrifying clarity. Patients with failing hearts consistently report cold extremities as the first warning sign their body sends before everything goes wrong. Here's how you know it's your heart. Normal cold feet warm up when you move. Heart failure cold feet stay cold no matter what you do. Patients describe feet that feel like ice blocks even in warm socks, even when the rest of their body is comfortable. Even in summer, if your feet are always cold, your heart is dying. Period. Symptom number 2, pitting edema. Do this test right now. Stop reading. Do this test immediately. If your legs or ankles are swollen, press your finger hard into the swelling for 10 seconds. Now release. Did a deep pit remain for several seconds? If yes, you have pitting edema and everything just changed. This isn't regular swelling. Research in the American Heart Journal proved a direct, undeniable link between pitting edema and right-sided heart failure. Here's what's happening inside your body. The right side of your heart is failing. It can't pump blood from your body back to your lungs. Blood is backing up like a clogged drain. Pressure builds. Fluid gets forced out of your blood vessels into your tissues. That indent, that's proof your tissues are drowning in fluid. That's proof your heart is losing the battle. This is an emergency. Symptom number 3, sudden leg weakness. Your muscles are dying. This isn't "I'm tired." This is something far more sinister. Groundbreaking research in Circulation. Heart failure revealed something that shocked the medical world. Chronic heart failure doesn't just weaken your heart. It literally destroys your leg muscles at the cellular level. When your heart can't pump efficiently, your muscles starve. Studies found heart failure patients have catastrophically low levels of myosin heavy chain protein, the machinery your muscles need to contract and move. Translation: your muscles are losing the ability to function. Worse, even after doctors improve your heart function with medication, the muscle damage can be permanent. The structural changes may never reverse. If stairs that used to be easy now feel impossible, your muscles are being starved to death by your failing heart. Symptom number 4, rapid weight gain. Your body is drowning. You step on the scale. You've gained 5, 10, 15 pounds in days, not weeks, days. This is not fat. This is your body drowning from the inside. The Mayo Clinic proceedings identified rapid weight gain as a red alert requiring immediate medical attention. This isn't about feeling bad about numbers on a scale. This is about fundamental system failure. Heart failure patients report gaining 10 to 15 pounds in a single week. Every single ounce is trapped fluid, not fat. Gravity pulls it to your lower body. Your jeans suddenly won't fit around your calves. Your shoes cut off circulation. Your legs feel like lead weights. If you've gained significant weight rapidly and it's all in your lower body with swelling, this is a medical emergency. Your heart is losing. Call your doctor today. Symptom number 5, blue or purple legs. Your cells are suffocating. Look at your legs right now. Really look. Do they have a bluish, dusky, or purple tint? That's cyanosis. That's your body screaming that your cells are suffocating. Research in the European Society of Cardiology Heart Failure Journal identified this as a major red flag. It happens when oxygen-starved blood dominates your circulation. The most gravity-affected areas, your lower legs, ankles, feet, turn blue first, because your weakened heart simply cannot push blood upward against gravity anymore. As heart failure progresses, this color spreads and deepens. That blue color is your body's way of saying, "I'm dying at the cellular level, help me." This isn't cosmetic, this is critical. Your cells are literally being starved of oxygen. Without intervention, tissue death follows. Symptom number 6, ankle swelling that never goes away. Most people think swollen ankles are no big deal. They're wrong, dead wrong. Ankle swelling is one of the earliest and most reliable warning signs that your heart is failing. Research in the Journal of the American College of Cardiology proved it's not just common. It predicts how quickly your condition will deteriorate. When your heart weakens, blood backs up in your veins, pressure builds, fluid gets forced into surrounding tissue, gravity pulls it to your ankles. Here's the critical difference. Normal swelling goes away with rest or elevation. Heart failure swelling does not. It persists, it worsens, day after day after day. Your ankles might look okay when you wake up, but by evening they're tight, swollen, uncomfortable, and getting worse every day. If you press and see pitting, you're not dealing with tired feet. You're dealing with heart failure. Symptom number 7. Wounds that won't heal. Your body can't repair itself. A tiny cut on your leg or foot should heal in days, maybe a week. What if it's been there for weeks, months? A landmark study in JAMA revealed why this happens in heart failure. Your body has lost the ability to heal itself. 3 devastating reasons. Tissue hypoxia. Your tissues are suffocating immune system failure. Your body can't fight infection circulation collapse. Healing nutrients can't reach the wound. Healing requires massive amounts of oxygen delivered through robust blood flow. When your heart fails, that flow stops. Even minor wounds become open, festering problems that may never fully heal without aggressive intervention. A wound that won't heal isn't bad luck. It's your body sending out an SOS. I can't survive like this. Some patients develop wounds that become infected, that lead to sepsis, that lead to amputation. Don't let it get that far. Symptom number 8. Leg pain that stops you in your tracks. You walk a few minutes, just a few minutes, and suddenly your leg muscles cramp with such agonizing intensity you're forced to stop. Doctors call this claudication. I call it your body's emergency brake. Research in the Journal of Cardiac Failure proved these symptoms directly correlate with plummeting cardiac output. Your heart can't pump enough blood to meet even the most basic physical demands. Your leg muscles are massive and hungry for oxygen. When your heart fails, they're the first to be sacrificed. Patients describe it like this: activities that used to be mindless, walking to the mailbox, light housework, now cause muscle pain, cramping, and exhaustion so severe they have to stop and rest. At first, it's just hills or stairs. Then it's walking across the room. Eventually, you become a prisoner in your own body. That's not aging. That's your heart failing to keep your muscles alive. Symptom number 9. Restless legs at night, the 178% miss. This is the one that could save your life tonight. You're exhausted. You crawl into bed desperate for sleep, but your legs won't let you. They twitch, they cramp, they demand movement. Sleep becomes impossible. 78% of heart failure patients experience this. Almost none connect it to their dying heart. Studies in sleep medicine reviews revealed the mechanism. and it's terrifying. During the day, fluid pools in your legs due to poor circulation. When you lie down at night, that fluid redistributes. It compresses nerves. It disrupts electrolytes. Your brain interprets this as an overwhelming, uncontrollable urge to move your legs. Combined with oxygen-starved tissues from impaired circulation, it creates a perfect storm of neurological chaos that steals your sleep night after night after night. If you can't sleep because of restless legs, your heart might be sending its final warning before complete failure. Symptom 10. Varicose veins exploding overnight. Varicose veins you've had for years suddenly get much worse, or brand new ones appear seemingly overnight. This isn't just cosmetic anymore. Your body is revealing a catastrophic underlying problem. Research in vascular medicine found a direct link between heart failure and explosive varicose vein progression, something most people never learn until it's too late. Here's what's happening. When heart failure develops, it creates massive backward pressure throughout your entire venous system. Your already weakened vein valves are subjected to overwhelming stress. They fail completely. Patients report veins that were mild cosmetic issues suddenly becoming large, numerous, painful, and functionally debilitating within months. Rapidly worsening varicose veins could mean your heart is creating deadly pressure in your circulatory system. Symptom 11. Shiny, stretched skin. Your body is drowning. Look at your lower legs. Really examine them. Does the skin look abnormally shiny, stretched tight like plastic wrap over bone? Does it feel thinner, more fragile, strangely smooth? This is not normal. This is critical. Research in heart and lung documented these skin changes in chronic heart failure patients. When fluid continuously floods your tissues, it doesn't just cause swelling you can see, it fundamentally destroys your skin's structure. Excess fluid stretches skin beyond its breaking point. It flattens natural texture, creates an unnatural shine, makes skin paper-thin and fragile. Medical professionals use this as a visual diagnostic clue because it's that consistent and reliable in heart failure patients. Your skin is literally being torn apart by trapped fluid. Symptom 12. Numb, tingling feet. Your nerves are dying. Your feet fall asleep, but they never wake up. The numbness and tingling are constant, all day, every day, sometimes so severe you lose balance and can't walk safely. Research in current heart failure reports prove these neurological symptoms are alarmingly common in heart failure patients. Two mechanisms are killing your nerves. Direct compression. Swelling physically crushes nerves, causing numbness, tingling, shooting pains, oxygen starvation. Your nerves literally can't get enough oxygen to function. They misfire. They send false signals. Your brain interprets it as numbness, burning, pins, and needles. At first, it comes and goes. As heart failure progresses, it becomes constant, intense, impossible to ignore. Some patients describe walking on pins and needles. Others say their feet feel completely dead, like walking on stumps. Here's the danger. When you lose sensation, you can't feel injuries, temperature extremes, or pressure. Unnoticed wounds can become infected. Infections can lead to sepsis. Sepsis can kill you. Final warning. This could save your life. We've covered 12 symptoms, 12 ways your body is screaming that your heart is failing. Let me be brutally clear. These are not minor inconveniences. These are evidence-based indicators of a condition that affects over 6 million Americans and kills more people than multiple types of cancer combined. Heart failure doesn't announce itself with Hollywood chest pain and dramatic collapse. It whispers through your legs and feet, the symptoms we just discussed. That ankle swelling that won't disappear, those perpetually frozen feet, that unexplained weight, the wounds that won't heal, the restless nights. These are your body's final pleas for help before it's too late. Do not wait for symptoms to get worse. Do not hope they'll magically disappear. If you recognize multiple signs from this video, more than just one or two, contact your doctor immediately. Today, not tomorrow, not next week, now. I'm not exaggerating when I tell you this could save your life. Early intervention in heart failure can dramatically improve outcomes. quality of life, and survival. We have medications and treatments that work remarkably well when caught early, but become virtually useless in advanced stages. The difference between life and death is catching this now. Drop a comment telling me which symptoms you recognized. Let's help each other survive this. Smash that like button if this opened your eyes. Subscribe so you don't miss critical health information. Turn on all notifications. Type 1 if this woke you up. Type 0 if you're still in denial. Your legs and feet have been trying to save your life. Now you know how to listen. Don't ignore these warnings. They might be all that stands between you and complete heart failure. Call your doctor. Get checked. Do it today. Your life and your time with the people you love depends on it. Thank you for watching. Now go take action. Your heart is counting on you.